Check, yes, thank you. Okay, good morning. Have we got any new attendees that have not been here before? If we have, welcome. I can't see all of the faces at the moment, but we'll come to you. We've had apologies from Mike Derry and Nicola Jones, I believe. Yvonne, any others?
No others, Susan.
Okay.
Sorry, Susan, we have apologies from Kathy Dinning, so I'm covering the papers for Kathy today.
Okay. Thank you, Katie. Just to note, this meeting is being live streamed onto our website, and members of the public will be able to send in questions today. I can see that we're quorate. Any declarations or amendments to declarations, additions relating to this agenda? Nora?
Good morning. Thank you, Chair. My name is Nora Simon. I recently joined the Southwest London CCG. I haven't got anything to declare, but I am yet to complete my declaration form.
Okay, welcome. Okay, so I think we can move on to agree the minutes of the meeting on the 29th of September. Has anybody got any material changes they'd like us to make to the minutes? No, we're happy to sign those off as a record. Thank you very much. I think most of the matters arising relevance are going to come up, but has anybody got any items they want to pick out from the minutes? No? Good. Right. I think you've got a copy of my chair's report that goes to the governing body meetings. Has anybody got any questions? I hope that's just a reflection, a summary of what happened at our previous meetings. Just self-explanatory. Good. We're going to whiz through this agenda. Look at it. We're going to move on to the finance update then. I think, Neil, are you going to take us through the papers that have been provided?
Yes, I am. Thanks, Susan. Good morning, all. So just to give you an overview of the South West London position, so I'll take you to slide 4 of the pack, which gives you the overall position, which has around about a £2 million deficit position for primary care. So just to be clear, the difference on that is picked up from the CCG programme allocation. Now, generally, because we reset the budget each year, it's very difficult to actually pinpoint where some of that underlying deficit has come from. But we know that that position hasn't changed significantly from what we've seen in previous years. So what we can say through the time when the South West London CCG has been together, that underlying position has not got any worse, but obviously conversely it's not improved either. So generally all of the payments, as you can imagine, because of the income protection that we've got around primary care, has largely stayed in line. So the contract payments that are being made, any enhanced services that we've got, the only real moving parts are around the additional roles reimbursement schemes and some of the premises costs, and generally any premises issues that we have can be covered from accruals that we've had from previous years. So that generally, that position remains in check. And on the additional roles reimbursement scheme, we've got an amount of money that's within our allocation. We are at the moment, and you can't probably tell from this report, but we are assuming that we will take up the full allocation. So that's the maximum amount that we're able to get in terms of those additional roles reimbursement schemes in South West London. I would say at this point that that's quite ambitious given where we are, but that's the current working assumption that we've got. And then on slide 5, this really just tells you all of the additional other funding that we're getting through. So this was what was previously known as the 5-year forward view, GP 5-year forward view initiatives, now called the Primary Care Transformation Scheme. And we've got a number of the areas, as you can see, set out in that table. At the moment, we are assuming that all of that will be spent by the end of the year. We're working with the teams to make sure that that assumption is correct. But this has become the sort of new way of money finding its way through to the CCG in terms of how this money flows through to us. So in other guises, it's known as sort of service development funding. So it's additional money that's coming out from the department. So it's a fairly the position is stable, other than to say that the £2 million clearly will need to be addressed at some point. And I think what we are proposing to do is to do a bit of a root and branch review going back a few years to try and understand where that underlying recurrent deficit has come out from, so that as we move forward we can then see, well, what steps can we do to try and address that. As we've observed, a lot of the money around primary care delegated is non-discretionary, so our ability to actually be able to influence and correct that overspend is not a very easy thing to do, and we all acknowledge there are things around premises in general which generally tend to go only in one direction, and that's not down. So our ability to get that addressed is going to be difficult, but I guess until we've done that review, and I'm hoping that we can sort of do that before we get to the end of this financial year, so as we move into the new organisation, we're all very clear about what the issues are within the primary care allocation that the CCG is handing over to the new organisation. But I'm happy to pick up any questions anybody may have.
Thank you. Yes, you've answered my question. Really was about it was about where that underlying deficit sits and who will have the responsibility for tackling that, because my understanding is that right, that any underlying deficit has to be found from within the CCG's total budget allocation. So it's going to have that has another additional impact on the other pressures that Place or South West London has as a whole. Really, is that correct?
Yes, that's right. I mean, I would say it's at South West London as a whole rather than Place, but I guess once we've worked through the budget delegation, we can be much clearer about that. But you're right, in overall terms, it's less money available for the health economy to cover where it has to put the money into primary care, the delegated primary care.
And picking up on your point about assumptions that you'll have spent all the money by the end of the year, that being the risks around that being what in particular?
Well, the risk is that, as we found out from the audit that we had last year, where we accrued a lot of expenditure into the position, and that got picked up in the final year audit, where the auditors did not expect that we would accrue for things unless there's a firm commitment to spend the money. So the very strict definition of what an accrual actually is. So the risk would be that we will have to give money back if we're unable to spend the money in this financial year.
Okay, David, did you want to pick up any points on the finance update?
No, thanks, Susan. I mean, clearly we look at the financial position as part of the overall position for the CCG through the finance committee, but there's nothing in addition I want to add. Okay,
thank you. I mean, the Winter Access Funds Plan, which is attached as a presentation, is down as a separate item, but that's another issue around funding. Is it you, Andrew, or Emily's going to talk to that?
Yep. Apologies from Emily. I should have said at the beginning.
All right.
So on the Winter Access Fund, so we've got a couple of slides in your pack from page, I think, 27 onwards. So this was obviously a big political announcement by the Secretary of State a couple of months ago. It's got 4 broad aims. Speed allocation of budget. One is, and it's a national £250 million scheme between November and the end of March. 4 aims are to increase overall appointment volumes in general practice, increase the proportion of face-to-face appointments with GPs, alongside ensuring practices get back to pre-pandemic activity levels, whilst also minimising 111 calls and so essentially kind of a broad objectives really designed to try and increase additional capacity back into general practice outside of the vaccine programme, that is, as well. So how we've tackled that in South West London is we've kind of adopted a practice first approach. Because obviously we certainly believe that that the best really is for practice to be given the opportunity to say whether they can, if they can get additional staff in, maybe work with their neighbouring practice or PCNs on additional services. So I'm pleased to say that we have the overwhelming majority of our practices who have confirmed to us that they are looking to put in plans in place from sort of November onwards through to the end of March to try and put on additional capacity, additional services in their practice. And what we've also done to ensure full population coverage is to work with all of us, and obviously that covers our 39, working with our 39 PCMs as well. Sorry, should I put my? Can you hear me now?
Yes.
Yeah, always the way. So we work with the vast majority of our practices, and we're also working to ensure full population coverage with all of our 6 federations. Some of the specific reasons for that are to make sure that we can make best use out of extended access. So there are sort of 8 to 8 offering, particularly at weekends and bank holidays. We're putting in place from this weekend a service with our federations where we'll be informing patients that they can contact a separate number and they'll be spoken to with local clinicians and booked in for a face-to-face appointment locally if that's appropriate. And also some of the PCNs and federations have got some quite good ideas of how they can perhaps work together over certain times to help manage the load on practice that little bit better as well. So we've done an extensive piece of work within the kind of short time that we had, both to work with all the practices, but also to try and make sure that from a population perspective, we've got as much additional access going into the system as possible this winter. And that also includes working with our local accident and emergency delivery boards as well. So this will obviously be very challenging. I think probably challenging even before the vaccine announcement, Bruno, really, in terms of additional workforce into the system this winter. But obviously we're trying to be as resilient and as focused as we can be on this. And I do know, just looking at the national data that gets published every few weeks from NHS Digital, I think we saw about an extra 25,000 patients in October compared to September as well. So we're certainly putting more into the system as things stand. And I'm sure, as I know not many GP colleagues are on the line today, but clearly looking at the data, we're already seeing unprecedented demand of general practice as well. So it really is about trying to focus that demand to make sure that obviously the patients who need to be seen by a GP do get seen by a GP as well. So it's a lot of work that's been going on for quite some time now, and this Winter Access Fund gives us the financial ability to kind of do more, get as many people involved as possible. And obviously with the vaccine programme, we're still really trying to focus on this, but clearly it will be a challenging few weeks and few months, as it will be for everyone, and we're trying to just play our part with that, really. So that's just the update for you.
Liz, you made a comment. Did that answer your comment in the chat about the update on? Are you there? Did I not see a comment? Yeah, sorry.
Yeah, sorry, I'm just an observer at the.
Oh, you are an observer. Yes, apologies. I see it's so many meetings.
Yes, it's John, but
I'll let Bruno.
I mean, I guess my question. It's obviously it's a larger answer than can be given in this particular meeting, but you know the announcement, which I gather primary care knew about at the same time as the rest of us, when obviously. I would have thought supersedes quite a lot of the planning. So I guess there's a longer answer to my particular question.
Okay, sorry, apologies. Bruno, you've got your hand up.
Yeah, there are two things really. Obviously, the kind of short-term 3-week focus on the vaccination programme, that's going to obviously have an impact. The one thing I'm concerned about, though, is that thinking back to the kind of original stuff that happened in terms of GP appointments and things like that, is people were deterred unnecessarily. So I'm wondering whether or not there's any guidance on the messaging from GPs so that people do not feel that the NHS and GPs have effectively shut down, because I know that is not the case, although if you read the letter from that was sent out, I understand, to GPs, the way that it's framed does make it sound as though it might be, because it leads badly, if you see what I mean, the letter.
Okay, thank you. Andrew.
Thank you both of you. Really important questions there. Just Bruno, take yours first. So you're absolutely right. GPs haven't ever closed. They've always been there for you. Always will continue to be there for you as well. And I do know certainly as a few days ago there was a plan for a big national comms push on that one. So that's something I'll take away to see where we are with that one. But that is clearly a very, very important message we want to forget. I don't think people are actually. I think that the phone line is still as busy, if not busier than ever before as well. But it is certainly something very important to be mindful of, and also to be mindful that we're supporting the people who need care the most as well. Because obviously there's only so much workforce that goes around. It's about trying to focus on they need the care the most, really. And on the vaccine access is still as important as ever, because it's vaccine, whether it's access, it's about sort of supporting the NHS, the critical care capacity as well. So we are really focused on trying to do as much amount that's being done to.
I think you might need to switch your camera off again, Andrew.
Yeah.
Work continues. Yeah. So I think it's trying to say that the work continues. Sorry, Mark.
And Bruno, just to add, going on to the kind of comms. So Andy made reference to kind of a national comms campaign, and I met with our comms teams yesterday about what the local information that we will be sending out, which is particularly around the NHS is open for you, but we do want people to use it wisely, and these are your routes in, depending on your need, whether it be a primary care need or whether it be a more acute need. So there will be over the next few days and weeks and kind of comms coming out from South West London as well as the national programme.
That's really good to hear, because I definitely feel that if the messaging is that GPs are having to redeploy staff, then people will stop reading after that sentence potentially, and that's messaging that I don't think is particularly helpful in this case.
Yeah, it's a very balanced and nuanced message, so I think our comms teams are trying to work that through just at the moment.
Good. Okay, John, you've got your hand up.
Yeah, I just merely want to echo what Mark just said. Earlier in the week, I had to attend my own practice. I was seen by a couple of people, both of whom had been drafted in from a former walk-in centre, as I understood it. And rather to my surprise, I was given a more of a once-over than I was actually there for. And I said, well, hang on, the newspapers tell us you guys are not doing this stuff anymore, and it just turns out not to be the case. So it's really important that locally the national message is not overriding what's actually going on the ground.
Well, reassuring. Thank you, John. That's helpful.
Yes.
Okay. David, did you want to ask any questions on anything? No. Okay. Right. Well, thank you for that. It seems like a mammoth task balancing that and the vaccine programme, and look forward to hearing the results of it, and recognise that a lot of people can't be with us today because they're busy now doing the work out in the field. Okay. Shall we move on to the next item then? John and Bruno, you've still got your hands up. I don't know whether you want to. Okay, fine. Move on to the Borough Reports. I think we've got Croydon. We've had them, so assume we've read them. Happy if you want to pick up 2 or 3 points from each of them, each of the leads. Who have we got on first for Croydon? It sounds like Eurovision Song Contest or something. I can't see all the names, so we just check who's here.
Aisha.
Aisha, right, great.
Actually, no, sorry, Susan, this is my own fault. There's a vaccine meeting going on until 10:30, so I said to them, join us at 10:30, because we won't be ready for you before. So perhaps if you swap around, thank you. Perhaps do the remedial notices, thank you, sorry.
Lovely. Okay, no worries. There was I trying to behave myself and follow the agenda and not move things around. And, okay, remedial notices. I think we've got 2 from Croydon, 1 from Merton, 1 from Sutton, and 1 from Kingston Richmond. Kathy, you seem to be down for a lot of them. But are you doing?
Yeah, I'll cover for Kathy's the 3 that were Kathy and Joe, if that's okay, Susan.
Yes. If you do yours first, and then we'll move on to the others. Okay. Okay,
I'll do my 3. Yeah, no, that's fine. So the first one is Mitchley Avenue in Croydon. So all of these are here to be ratified. They've all been issued already, and so they're all here to be ratified through the governance process. So Mitchley Avenue. We have issued a remedial notice. It requires improvement overall, and we had previously not issued a remedial notice in 2019 after a CQC inspection then, and sort of gone more down the line of joint working and support to the practice, which is still ongoing. The reason for now issuing the notice is that the practice had, in the most recent inspection, dropped down to inadequate on safety. And so when it was discussed at PCMG, it was felt that was the most appropriate action, and in line, again, all of these are here and being handled in a consistent way across South West London. So we're trying to take the same approach where it's particularly safety and well-led domains, following the London protocol for when remedial notices should be issued. So yes, the Mitchley Avenue one, the details in the paper for people to see, but yes, it's here for ratifying.
It seems as a sound rationale. I think the issue is, how do you judge? I mean, given an inadequate judgment, can you tell us how you judge the risk to patient, and just remind us what the time frame for change is?
So the practice, so obviously the CQC have the detailed report which outlines all of the issues that were found, and we issue the notice and give the practice 28 days to respond with their action plan, which the team then go through in detail and pick up any sort of further queries. So there's then the ongoing kind of support and monitoring the implementation of the action plan until the CQC would return down the line to re-inspect and hopefully sort of lift up on some of those domains if the improvements have been made. Obviously, if the concerns are ongoing, then we're sort of into, repeated notices and more intense scrutiny and support to the practice. I suppose it's trying to put in the support as well as the contractual action. So sort of work jointly with the borough teams, who obviously have the closer relationships with the practices and the quality monitoring side in the borough. So obviously from our angle, we're doing the contract side and then working jointly with the quality teams in the borough to try and put in the right support where it's needed.
Okay, so I got a nod from David and Mark, so we can ratify that decision. Thank you. Okay. You're going to do South Norwood?
I'll do South Norwood Hill and then Village, shall I, while I'm here? So South Norwood Hill, so I suppose they're all of a similar theme, and they've all got challenges in different areas, but again, here to ratify because we've already issued the notice. The well-led domain had come down from good, so it overall requires improvement, and there had been a slight deterioration in the well-led domain since March 2020. It was similar to the last one. We hadn't issued a remedial notice at the time, and again, with the timing of the last inspection, it was just as COVID was starting, and so I suppose there was an approach taken at that time in March 2020 not to issue a notice at that stage. However, again, there's been a discussion at Croydon PCMG, and it was felt by all that it would be the right course of action to issue the notice and request the formal action plan and just kind of commence that process.
Are we happy with that, David? Mark? Yes. Okay, ratified. Then you want to pick up on the village surgery?
I'd like to do village then, yeah. So the village surgery, you'll have seen in the paper that there was an unannounced inspection at the practice earlier in the autumn. The practice was rated overall inadequate and placed in special measures. There were a range of concerns which are detailed in the paper in terms of safety and governance within the practice, hence the seriousness of how this is being, in terms of how this is being treated by the CQC. And so what that means is we would expect a re-inspection by the CQC probably around March time. In the meantime, the practice are it's a monthly process of monitoring with the CQC where they've submitted an initial action plan which was deemed satisfactory by the CQC and is being updated and monitored monthly. The CQC are dealing with any specific concerns that they pick up as part of that monthly monitoring. From the CCG perspective, we issued our remedial notice off the back of the CQC published inspection. And a lot of the responses provided are similar to what the practice have already given to the CQC. So overall, the response we've received was satisfactory, with a few minor follow-up areas that the team are taking up with the practice. So that's the overall position. So it's a sort of watching brief, closely working with the practice to make sure the actions are on track. and then we will obviously work jointly with the CQC around any action that's needed following the next inspection. It's noted in the paper, obviously, if the improvements by the next inspection are not deemed satisfactory, the CQC would initiate enforcement action in line with their usual protocols.
John, I know you wanted to raise a point about the village surgery. Did you want to? You're on mute at the moment.
My mistake. It's just perhaps just a small point. There seems to be a slight discrepancy between a report that was at the PCMG last week, which rated the practice as good. And I'm just wondering why it's now rated as unsatisfactory in the way we've just discussed, and whether that's because the CQC report on the unannounced inspection in September wasn't available at that time.
Yeah, it's to do with, it's just simply the timing of when the reports have been pulled together. So I think at the time of the last PCMG last week, obviously we did know the published CQC report had been published at that time. I think the issue is an oversight in terms of the production of the quality report at PCMG was pulled by the Central Business Intelligence team, I think, prior to the publication of the report. So it's a timing issue, and it will be corrected. I think the team have already picked up on it and corrected it, so it'll be up to date for the next PCMG meeting. But apologies, I think that's just a slight confusion due to timing of the reports.
Okay, and can you just explain, was this a practice that you had concerns about, and are there lessons to be learned from this in moving forward?
So I think in terms of the practice, obviously the previous CQC back a few years ago was good, and so I think things have obviously become of a concern more latterly. So during this year, there were a couple of concerns, probably spring, early summertime, which the quality team were involved in investigating. And so I suppose there were a few signs starting to pop up on the radar, and the quality team had been supporting the practice to look into those concerns at the time. I think probably over the late summer, it was becoming more apparent that there may need to be some intervention at the practice. Yes.
Okay, so it's David, you've got your hand up.
I'm happy with the action that there's got to be a remedial notice for this practice. Just looking at the specific concerns, a number of these strike me as really being quite urgent to be sorted, and it's not as if they can be, the practice decide in their own time to sort them out. And it's particularly things like, the failure to monitor and assess patients with high risk medicines. It's that sort of stuff, and I just want some assurance that actually on the ones that are more urgent, that we're really on top of those, and also a sense that if they are not being addressed, then what action will we be taking?
So in terms of how those are being dealt with, so there was obviously a very, very lengthy report from the CQC and a letter of condition that went to the practice immediately. So prior to the report being published, there was a letter of condition laying out the detailed clinical concerns, of which those are summarised in the paper, but those you refer to, David, such as the risk drugs and monitoring long-term conditions, etc. So the conditions that were placed in terms of allowing the practice allowing the registration of the practice to continue were such that the practice had to respond very quickly to identifying the patients and reviewing them, and that was being managed by the CQC. So I suppose there were several deadlines in the CQC conditions letter that required the practice to have identified the patients, provided evidence that they were being brought in and reviewed, and the detailed action. So I suppose the detailed monitoring of those concerns is sitting with the CQC, and they're briefing us on that they are currently satisfied that those actions are being taken in the timeframes required. So that's how it's being handled, and was handled in the immediate sort of aftermath of the inspection.
Okay. I shouldn't really be asking this, Liz, but did you want to ask a question?
Yes, please, because, as a Kingston, I was very concerned at reading this, because it's not only the clinical issues, it's management issues as well. It's a two-handed practice, as far as I can see. It lists a breakdown in the relationship between the two GPs and a bullying culture. So I was extremely concerned, and I was even more concerned. I was quite startled to read it and go back to the primary care management group, which had been on the 7th, because I thought, I don't remember, I would have noticed this, to see that at that point it was listed as on the quality reports as still being green. It was noted that the 9th of September was the date of the inspection. 3 months for the data to actually get to a local level via, I gather, another body does seem unacceptable for something as serious as this. And I did raise it locally, and I have been assured that steps are being taken, that the data reaches the local reporting level much more quickly, because 3 months for a situation as serious as this concerned me greatly.
And totally noted about the report being out of kilter, and I think obviously we need to pick it up and make sure that doesn't happen again. Apologies for that. I think just to note, in terms of the handling of it, so obviously in the immediate aftermath of the inspection and when we were aware of how serious the concerns were, we weren't able to discuss those openly. So I think usually some of these issues are coming to the main PCMG meetings. I think due to the at the time, in the gap between the inspection happening and the information being published, it was discussed at part 2 of the PCMG meeting, which is why probably with hindsight we should have at the December PCMG brought that through the main meeting, where you all would have been able to get more oversight and ask more questions. So I think there's been a sort of immediate handling in the crisis period, sort of after the inspection initially happened. And yes, you're quite right that we should have had the correct information at the PCMG part 1 last week.
Okay, thank you for that. That's very helpful. Okay, shall we move? We approve the ratify the decision for that one. So then there's the Mitcham family practice in Merton. I think is Christina. Hello, Christina.
Yeah, hello. Yeah. So yeah, again, the remedial notice has already been issued. So this is about the ratification again. So it's a second remedial notice for Mitcham family practice. But just to give some background, they were issued a remedial notice in September 2019, where following a visit in August, they scored requires improvement overall. They were good for safe and responsive, requires improvement for effective and caring, and inadequate for well led. So yeah, a remedial notice was issued for that. They were then re-inspected in February 2020, where they were rated requires improvement again, but because the report was came out in May during the pandemic, no remedial notice was issued for the same reasons that Katie described for the other practices. So then their most recent inspection, which was in June 2021, they got requires improvement overall again. They were good for safe and requires improvement for all the other domains. So I won't go into the details of the report, but there's an overview in the paper that was circulated for today. And the full report is online as well as the evidence table. But if you do have any questions, though, I'm happy to answer anything. So if you wanted to get in touch with me. So following this report, we went to Merton PCMG in September with a recommendation to issue a second remedial notice, and this was approved. So a second remedial notice was issued on the 14th of September. Alongside this, we have offered support to the practice to help them to avoid slipping into any special measures. So we met with them earlier this month with the borough team as well, and also the LMC. And we provided them with some sort of practical suggestions and offered support where we could. And we will be having a follow-up meeting with them at the end of January to review any progress. So yeah, we are sort of offering support as much as possible for the practice to make improvements. But yeah, so looking for ratification of that today.
I mean, again, the rationale seems sound. The issue for me is confidence that they can turn around and whether they're accepting the support that they need. It seems to be a lot of the practices that fall down against the CQC have a leadership and well-led issue that they need support with, really, isn't it? That seems to be the crux of it. If they've got good leadership, then often they can turn those things around. And I just wondered, are they picking up on the support that's being offered, and is that being addressed?
So at the end of the meeting, the clinical chair, did sort of listed the specific actions that we had previously discussed in the meeting, and asked them sort of one by one to agree to those. So we have assurance from them that they will be sort of taking the actions that were recommended, and we will be reviewing it in January. Of course, see where they got to with those. But we do have, at the moment, assurance from the practice that they will take those actions. Yeah.
Okay, David, did you want to pick up anything?
I guess it's the same point I made. It's around the ones that are more urgent, that they're actually being addressed urgently. And again, there are some issues here around safety, wasn't there? But again, prescribing, it seems to have cropped up as, but again, provided we've got that assurance that they're going to address them. If they haven't addressed them, again, with those sort of concerns, that action then has to be taken, doesn't it? Because they're potentially, patients are being put at risk on some of these.
Yes. Mark, did you want to add anything?
I suppose it's possibly just to provide the board with assurance that the local teams are very on top of this, as in they're straight in there and supporting practices and working with the practices. I do think there is an issue just in terms of how we report things and the kind of 3-month lag before it gets to kind of this committee is kind of concerning me as well. And I do think for us as the CCG, just picking up on David's point, is there when do we hit a kind of barrier of support here, and where do we actually then take some contractual action? Because you can support practices to the nth degree, but if you're on your 4th requires improvement, actually what action is available to us? So I think we do need to take that back inside and have a conversation about that.
Kezia, did you want to say something?
So I just wanted to add what Mark said, that we're working very closely. We have clinical lead involved, but also we are looking at the options. So remedial breach is a contractual option, but we also look at what could be like the worst case scenarios, taking legal advice and just looking at the capacity in the area, especially with that particular practice.
Thank you.
And we made it clear to both partners what the risks are if the rating is not improved. So very aware of the risk of even losing a contract.
Okay, thank you. Right, and the last one was Beach's surgery. Gary, is it Gary who's reporting on that? Thank you.
Yes, hi everyone. I'm Gary Bradley from South West London Primary Care Team, here to talk about the Beach's surgery from Sutton Borough. Following a recent inspection by CQC, Beaches were reported overall as requiring improvement, and the Sutton PCMG met on the 7th of December and approved the recommendation to issue Beach's surgery with a second remedial notice, and the committee today is asked to ratify that decision. Following their inspection on 30th September and the report published on the 29th of October, the following were required improvement. That is, are services safe and are services well led? We've tried to highlight and summarise some of the issues in the paper, and also a bit of the inspection history for this practice. So the key points are all highlighted in the paper, and more concerning is the summary of the previous CQC inspections going back to 2015, where it's been inadequate special measures, improvements found, still require improvement, then good, and then in 19 again requires improvement. So there's concerns over the history and maintaining the quality. So yeah, the recommendation today is to ratify the PCMG's decision to issue the second remedial notice to the practice, and additional support will be provided to the practice to help them make necessary improvements and prevent them slipping into special measures. Thank you.
Again, it seems like a sort of sustainability issue, isn't it? That you put the measures in, they make the changes, and then they're left to their own devices, search for, and then seem to not be able to maintain it. So I think each of these that have multiple remedial notices, good to have some sort of process that reassures us that we're, as Mark was describing, know what we're going to do about it, because it's they seem to go on a cycle that they. Are you happy to approve, David, Mark, ratify that decision? Thank you very much, Gary. Right, we'll carry on and do the mergers, and then we'll come back to the Borough Reports, if that's all right. Okay, so I think we've got 2 mergers to approve, is that right?
Yeah, that's right. Yeah,
it's you again, Katie. I thought
it's me again. She went very bored of me. Yes. So the first one is Mitchley and Selsdon Park. So the history on this one is the practices have been working together closely for a number of years, and the paper describes.
Is this the same Mitchley that we've just been talking about?
Yes,
right.
It is. So yes, the paper describes that the partners have been named on each other's contracts for a period of time and working closely together. They have now requested the formal contractual merger. It's been supported at PCMG and it's supported by our team. So the proposal would be that Selsdon Park becomes the main site and Mitchley Avenue becomes the branch site. From a patient perspective, we are assured that patients, because the practices have been working quite closely together anyway, it shouldn't be, the team are assuring me that there shouldn't be a noticeable difference for patients. So there's no risk. We've got assurances there's no risk around a closure of a site. There's no risk around any deterioration of access. In fact, we would hope obviously patients should benefit as a sort of byproduct of the increased efficiency and ability of the practices to work together through one merged list, that would bring some efficiencies and enable operational improvements within the 2 sites. The other point to note is that obviously we were just talking about Mitchley Avenue a second ago under the CQC item. I think it's understood really that the practices struggled a little bit with resilience, and I think this is seen as an opportunity to help build the resilience within Mitchley Avenue, and sort of bring the practice under that formal contractual arrangement which will allow that improvement to happen. So PCMG has supported the proposal on that basis as well, because it really should support that continued drive and improvement from a CQC perspective. There's been engagement with patients through the PPGs and the proposal's been supported. There would be further communication and engagement with patients in terms of obviously communicating the change. We've had another merger that's happened in Croydon earlier this year, and obviously a letter went out to explain what it meant, but in reality that were not sort of material changes day to day for patients, but obviously patients would be notified. The final point to note is that with the merger there is an IT cost pressure that the CCG usually pays, so it's about 13k we've been advised for this merger and the other one that's on the paper on the agenda as well, in terms of cost pressure to do the IT merger and the technical side of that. So yes, it's here for approval. I'm happy to take any questions.
So strategically looks like a positive mood given our conversation around Mitchley. Presumably the Selsdon practice are aware and will take the lead in terms of addressing some of those issues. Yes. And the time frame, will that fit in with the action plans? Are they helping support the action plans that are already?
Yes, I think the management of it now is already being led through the Selsdon Park side, because I think because of the kind of ongoing sort of resilience issues at Mitchley Avenue, I think the response is already being led because the partners have been named on each other's contracts. They're already dealing with and are clearly well aware of the concerns, and they see this as part of the solution to enable them to kind of bring things together in a more streamlined way and probably make the day-to-day operational and admin side and the practices easier as well.
Okay, great. John.
Thanks. Katie's kind of anticipated my question. Was the reports are a little silent on patient impact and how the patients have been engaged with these merger processes, this one and the one that follows. And I was just going to kind of seek reassurance that that has happened, and obviously, well, it sounds like it has, so that's really good news. In particular, I was going to ask whether these mergers impact meant any potential changes to the physical locations of the practices or something like that. But again, that's not going to happen.
No, and yes, and the same conversation happened at the PCMG meeting actually before, just to make sure. So we've been back to the practice to seek that additional assurance, for example, around the sites remaining open, access remaining consistent, so we wouldn't expect any deterioration. If there were any changes the practices wanted to make later down the line, that's subject to a whole new kind of business case proposal. So, you know, if there's something were to come up in a couple of years around changes the practice wanted to make around the sites, that would be subject to scrutiny and further business case. And I think we've been clear with the practices that this is being approved on the basis that sites remain open, everything remains as good as it is now from a patient perspective, and hopefully better through some of the improvements. And I think, yeah, I take on board the point about the papers are probably a little bit light on the patient side of it, and apologies for that. I think it's probably, we do need to strengthen that. I think to note that the reason for that is probably because it really is more of an administrative exercise to bring the contracts together, because the practices have been working in this joint way for some time. But yeah, we'll take on board the feedback, because I think we could have strengthened that with hindsight. So thank you.
Okay, David, did you want to ask anything? Or are you happy with that proposal?
No, I'm happy with the proposal. Yeah, it's fine. This one, yeah.
Okay, Mark, anything you wanted to add? No, fine. Okay, so we approve that proposal for the merger of Selden and Mitchley. Bridgestock and Broughton Corner, you covering that one as well?
Yes, so it's probably obviously different practices, but a quite similar set of themes really, in terms of the practices have been working closely together since earlier on in 2020. Brigstock family in the proposal would be the main site, with Broughton Corner as the branch site. Because they were both discussed at the same CMG, we've had the same follow-up discussion with these practices around assurances around the site remaining open, assurances around the provision of the access and provision of services. This paper, I think, is lighter or doesn't give assurances around the engagement, and I picked up on that just as we were preparing the committee. So we've had a further discussion with the practice in advance of the committee, just to pick up on their engagement with their PPG. They've completed and undertaken engagement with PPGs at both practices, both of whom were supportive. They had questions, but they were supportive of the proposal. They've also laid out clearly the communication approach in terms of writing to patients as well. So apologies again that wasn't reflected sufficiently in the paper, but I can provide assurance that has been taken into consideration. Similarly to the last one, a 13k cost pressure for the CCG to support the IT technical merger.
Okay, well, it seems like it's a good proposal, sound and built on an alliance that already exists. I'd be happy to approve. David?
Katie, can I just ask one question? It says under the merger there would be one PMS contract. So can I just check on that? Because most practices have moved back to GMS. So are we comfortable with that they'd stay on a PMS contract?
Yeah, we still have, I think nationally, most are GMS, but in South West London, we still have a huge amount of PMS practices. So yes, while many have transitioned, we still have a significant amount of PMS. So yes, I think we're happy on that basis that they continue, yes.
Okay, Mark, anything? No, fine. Okay, so both mergers have our approval.
Thank you.
Thank you very much. I am just going to carry on down the agenda, and then I'll come back to the Borough Reports. There's another item. Is this to ratify the Wellington PCM change of membership?
Hi, yes, good morning, everyone. We're asking the committee to ratify Sutton Primary Care Management Group's approval for a change of practice membership for Wellington PCM. So Sutton PCMG approved the request at their November meeting, with the change effective from the 1st of November. There are 4 PCMs in Sutton which were established in 2019. Carshorten Field Surgery was the only practice in Sutton not to choose to sign up to a PCM. It was agreed that their patients would be assigned to Carshorten PCM for access to services such as extended hours provision. However, Carshorten Field has now submitted an application to join Wellington PCN, effective from the 1st of November 2021. Both PCNs are in agreement, and one of the clinical directors for Colstalton PCN was also present at the Primary Care Management Group meeting and confirmed their support for the change. So this paper sets out the membership details for each PCN and the list size information. We've included the catchment areas for both of the PCNs, and as you can see, the location of Colstalton Fields falls just within the Wellington PCN area. Details are included regarding the service provision. So with extended hours access continuing to be provided at the hubs, this would not be any change for the patients. The finance team are aware, and we've included details of the change of income for both PCNs. The total change of income will be just over 60,000, which will be an increase for Wellington PCN and decrease for Colstalton PCN. We've included some further details around the PCN dev spec just for information. And as this is mainly seen as administrative change, there will be little or no disruption expected for patients. Next steps have mostly consisted of working with the finance team to make the necessary payment adjustments. The extended access requirement has been communicated to the PCN. As you can see in the paper, there will be a slight increase to their weekly provision following the increase in the PCN list size. And that's generally it. So we're just asking the committee today just to ratify the group's decision to make the changes to the PCN membership. Thank you.
Thank you. I mean, my assumption is that all parties are happy with the proposal. We can justify the decision in light of the framework for PCNs and the DESs, and we're happy to approve, I think. We've got nods from David and Mark and ratify that decision. Thank you very much, Paul.
Thank you.
Right, we'll go back to the Borough Reports then. Aisha from Croydon, are you here now? Yes, back from your vaccine meeting.
Yeah.
Welcome. Assume we've read it, just highlight any sort of key points that you want to raise with us, observations. Thanks.
Yeah, so I think some of the issues that we discussed at our primary care management group have been brought to this committee for final approval. We had the regular discussions around IT updates and quality, some of which has also been discussed here. There were some Croydon-specific work that we're doing around bringing in Ardens, which is a management support software for practices to help with automation of payments, etc. So that was brought to our committee, as well as there's a piece of work around Solace, which is a risk stratification tool, which has been decommissioned across South West London, and we just highlighted that to the committee as well. Yeah, I think in terms of the updates, the committee have read the paper, so I will take any questions.
No, thanks. We've covered the main items that you wanted us to cover. That's very helpful insight. Okay, I know Ahmed's not here. Does anybody want to highlight any issues from the... Hello, Tanya.
Hi, sorry, can I
yes.
cover up Ahmed if that's okay? So I think, as you said, many of the issues that we talked about here are covered at the PCMG, but the paper refers to the October meeting that took place just because of the timing of the papers. There was we did discuss the outputs of a recent desktop review of the locally commissioned services across South West London. So that review is ongoing. And it may have been discussed here before, but has the potential to kind of significantly restructure how LCSs are commissioned. We aim to improve value for money, realise additional benefits, and harmonise requirements across the boroughs. We're now going to do a more detailed assessment on some specific LCSs in the borough, and a programme board, which will include local clinical reps, as being set up to oversee any changes to that. As with each meeting, we also reviewed the contents of the primary care quality report. And at this meeting, there was a particular deep dive review of CVD prevention and diagnosis in primary care. We also talked about the work of the Kingston and Richmond training hubs. Also we discussed the launch of the Medicines Incentive Scheme, which launched in October. A proposal was put forward by RGPA, the Richmond General Practice Alliance, the federation in Richmond, regarding care navigation training for general practice staff, and that was approved. And we also discussed the Kingston and Richmond estate strategies, or reviewed those, following agreement of the Health and Wellbeing Board. Thank you.
Great. It's good to see, because we always had the conversation about locally commissioned schemes and see the programme of work that's progressing. So thank you for that insight. Any questions from anybody? Bruno.
Yeah, I have a question around the thing you said that you mentioned around the care navigation scheme. Do you look at the way that that kind of fits into what's being done already in terms of social prescribing? Because there's some potential overlap there. I recall that from discussion previously around care navigators within GP surgeries and social prescribing. So is it likely to be integrated with that, or is it likely to be entirely separate, or what?
So if I can just respond to that, in terms of the social prescribing service in Richmond is actually provided in part by RGPA, who are very much involved with the care navigators. They also provide some of the care coordinators into practices. So we very much try and align all of those roles within primary care and then the social prescribing service with each other, and provide training across the board to those roles as well. So hopefully they should be very much knowing what each other are doing and aligned with each of the services. That's the aim.
Mark.
Okay, yeah, I was just checking. I was off mute. Tanya, just in terms of the locally commissioned services, and you've got your programme kind of approach, I'm just, are the LMC involved in that as well? I just wanted to double check.
Very much so, yes, Mark. Yes.
Thank you.
Right, well, thank you, Tanya. Sian Sutton? Sian here. Oh, you are there. Couldn't see on my list of names, Sian. There we go.
Yeah, so we had our usual update from the team who were supporting Team GP Centre with their work following their CQC report. Hackbridge relocation continues to be delayed. We're sort of working with the team there. The practice are fine staying where they are, but that's a source of frustration, which is just to do with the build site. We did have an application for a boundary change, but we've gone back to the practice and asked for further information, that we want to make sure that the circumstances are exceptional. So that it doesn't sort of create a domino effect from other practices. So that's still ongoing. We every primary care management group meeting, we always have feedback from our PCN team of 4 different areas. So around their ARS recruitment plans, and they are planning to use their full allocation this year, and probably have a bit of an overspend as well, which they can cover from other sources. A lot of discussion around just the busyness in general practice, and then that sort of then developed into the discussions around both sort of primary care escalation planning, but also then the winter access fund schemes. We had a presentation from the GPIT team, which was really helpful, just to have that sort of wider discussion around a number of work streams, and lots of interest in Sutton of taking schemes forward. And our medicines optimisation team presented some standard operating procedures around antibiotic audits and insulin prescribing, and a couple of other things. We also had there's also in the pack the feedback from our quality group, which continues as a separate meeting. We were looking at the changes around national patient safety alerts and what's required of general practice, which is quite a big change, and important that people understand that. And we also had a presentation back from our colleagues at Sutton Health and Care, who are supporting around learning disability health checks. So they've been commissioned till March 2023 currently, and they very much work with the sort of harder to reach learning disability patients to encourage them to have those physical health checks, and they're being really successful in making sure that those health checks happen, and the practices really appreciate that, because it's quite
time consuming to bring some of those people into the practice. And then finally, our home visiting service. So we had a deep dive looking at the home visiting service, which is provided by our PCNs. It previously has been an acute home visiting service, so very much responding to quite urgent home visiting requests. However, it's now been expanded so that it both provides a 2-hour response, but it also will see more routine home visiting requests as well if they have the workforce to allow that. It's staffed with paramedics through the additional role reimbursement scheme and is working really well and really valued by practices. It's doing exactly what it should be doing, which is allowing the core practice team to remain in practice, seeing patients there rather than having to do the home visit. So it's working really well.
Okay, thank you. That's very good. Any questions for Sean? No, well, thank you very much. Really helpful oversight. Kate, you've got Merton and then Wandsworth. That'd be great. Thanks.
I'll probably take them as both together and point out some of the salient points for each of them. For both of them, I think we've already covered off some of the key kind of areas we've discussed, as always, with CBD and with COVID and with the winter planning. But just to point out some of the key points from both the discussions at the PCMGs over the last couple of months have been around how we're supporting our primary care at scale funding with our PCN, so reviewing their plans and just having some oversight on what their proposals are in terms of their use of that funding, how they're going to utilise it over the next 6 months when we had the conversation, and the same for discussion around their organisational development plans as well. And what those pots are looking at is supporting our PCNs and really importantly right now in terms of how they work together and how they can support leadership. And obviously when we're thinking about transitioning as well into the ICS, these have been really crucial parts of the pot and programme. So we have had a discussion around those. Particularly in Merton, we've also discussed, not discussed, but reviewed how the ARS, the Additional Roles Reimbursement Scheme, is working across the borough. And we've just had a conversation around what posts and staff are in place and how that might look. So it's just really for note as part of the group, but we thought actually as a pre-CMG it was worth understanding what positions were coming in and how the plans were taking shape for next year. So that has been some of the kind of other points to note. As always, we've picked up some of the key kind of discussions from the primary care quality review group in the report that you've seen, and we've picked up already from Merton particularly the ask around the Mitcham family, and that's been picked up already in Katie's paper. But also just to note that we did also report 2 of our practices moving from requires improvement to good as part of the support programme. So I think it's always worth noting those as well. Some of the positives as well as where we've got some of the more challenging ones. So I'd like that to kind of be noted. And just to kind of reflect back, I think for Wandsworth, as I said, very, very similar discussions. We have noted in the primary care quality update around Tooting South, who have been raised as inadequate on their CQC under effective. And again, I think we've picked this up previously, but just to point out in terms of the conversations, these are one of the really early conversations we picked up with that practice. Prior to even the report coming out, that practice actually came straight to our local team and asked for support on this. So I think when we were talking earlier about maybe some of the delays, I should also reiterate that many of our practices through the good working relationships, when they see something that worries them in terms of their ratings, many of them do come to us directly before the report, and we start working with them immediately on some of those areas that we can improve. So it's just to kind of pick that up and note that as well in the paper.
Right, thank you very much. Any questions for Merton and the Wandsworth reports? No, it's always useful to get some insights of what the sort of key issues are, and also to see things that we've seen come through here strategically being taken forward. So thank you for that. Have we got Bruno? We've got a question.
Yeah, this is a question for you, Kate. Although it applies more generically, you were referencing PCN development and the funding for that. The voluntary sector does feed into that, albeit not necessarily quite so much as NHS organisations do. But there are pressures there for the voluntary and community sector. Are you seeing that is kind of being reflected in the concerns that there are about development of PCNs at all?
So I think in terms of how our local PCM plans to take on board, I think it's probably safe to say that many of them have some strong working relationships already with the voluntary sector in terms of some of their approaches. I think it probably in terms of how they're looking at specific projects. I don't have the list of the detail of the projects that might kind of help support some of the local links with the voluntary sector, but I would say that I think our funding is being utilised to the best that a primary care network can do in terms of based on their local insight and intelligence and to who they need to work with. But I think it'd be a useful kind of challenge back maybe to some of them in the future about how they're working jointly and what their links are and how they might want to utilise the voluntary sector. I think that would be a next step or a challenge for them.
I think one of the interesting points is that the voluntary sector are reliant on funding from other sources, aren't they? And so sometimes their capacity is constrained because of limitations. So when you do want to work with them, sometimes they won't be able to. So it'd be interesting to get some feedback on whether
if they're useful enough. And so I'm just looking at
both ways, really, not just our funding, but their funding that they're able to engage really as important players. Okay.
Thank you, Susan. That's useful. I'm just looking at some of the specific projects, and they're very much around utilising local intelligence and working with local community groups and community engagement. So I think I would hope that they do have the ability to utilise the network and the voluntary sector. But I will kind of ask that question next time and see whether or not there is any challenges with working with, as you said, funding in different sectors. So thank you.
Thank you, Mark.
Just to add that in terms of the kind of winter funding that came down via NHS England, our local authority colleagues put some bids in, and some of that was around the voluntary sector kind of supporting the winter. And we are also within South West London, we're allocating about £50,000 per borough to support the voluntary sector in supporting us in the winter challenge, if that makes sense.
Thank you, very helpful. Okay. Right, have we got any other business? Andrew, Mark, no. Okay. Have we had any other public questions? Yvonne, I haven't been notified of any. Oh, are you going to be a public question, John?
I don't mind. Okay. I guess I'm a member of the public as well. This is a question that doesn't necessarily need to be answered now, Susan, but it does seem to me useful to try and clarify what the future of this meeting is going to be when the ICS arrangements are rolling forward, and primary care will be deeply rooted in place, obviously. And so we'd just be interested to know what the future of this meeting is in due course.
Okay, well, we'll take that away, and then hopefully as the governance models emerge, we might be able to share that and have that. And if we're meeting in March, which will be our next and last meeting, have some view about what that handover process looks like to what structure that we're working with. Okay, thank you, John. Right, well then I'll close the meeting. Can I first thank everyone for all your continued support for the Primary Care Committee, Primary Care and the local boroughs and place. I hope you all had a good Christmas and stay healthy. I think that's the phrase in all my Christmas cards this year. And hopefully see you in the new year, if not before. But thank you very much indeed.
Thank you.
Bye-bye.